So this is Nasogastric tube. So prior to coming into the room, I'm going to check the order and review the coagulation studies. I'm then going to gather my supplies, which is a piston syringe, a cup of water, a 12 French NG tube for this particular client, tissues or a washcloth, a Chuck's pad. I'm going to need some kind of lubricant, a pulse ox, alcohol prep pads, a pen light, a tongue depressor, a marker, tape, a rubber band and safety pin, a pH strip, a kidney basin, and then the bath basin is what I use most of the time for an emesis basin. When I come in the room, I'm first going to come over and check my suction. I'm going to turn it to continuous first, and then if the provider ordered low intermittent suction, I want it to be in the green. I'm going to turn it off after I check it. Then I'm going to come in the room, bring all my supplies with me, perform hand hygiene. I'm going to introduce myself to the patient. Hi, my name is Faith. I'm a nursing student at Northwest Arkansas Community College. Can you tell me your name and date of birth? Are you allergic to anything? No. Are you in any pain right now? No. Going to ensure privacy. Then I'm going to come and get my supplies set up and ready to go. After I raise the bed, as I'm raising the bed, I'm letting my client know if at any point during this procedure you start having difficulty, you can raise your hand and we'll stop the procedure. I'm going to place the client in a semi-Fowler's to high Fowler's position for this procedure at about 45 degrees. Then I'm going to lower the rail on my side. Hand them some tissues, drape their chest, hand them the emesis basin. Then I'm going to assess their cough and gag. I'm going to block off each nerve to make sure that they can breathe if one's occluded. Then I'm going to assess for any septal surgery, sinus surgery, deviated septum, or any kind of nasal trauma that would impact. After I've assessed that, I'm going to place the pulse ox. I'm going to place it on the side that I'm going to have a partner for this procedure as well to help assist. So Catherine, if you'll come and assist with this procedure, that would be lovely. Then I'm going to put on clean gloves. And clean the bridge of their nose. Close your eyes. Want to make sure I'm not getting any alcohol in their eyes, as that can burn, and that helps get all of the moisture from off their nose. As I'm waiting for that to dry, I'm going to go ahead and get some temporary tape ready to go. After I've cleaned and if my facility had a commercially prepared device, I would grab that. Okay. Now open up my NG tube. And measure from the tip of their nose to their earlobe to their xiphoid process, which on this client is kind of challenging to find. So we're going to go about right there. Then going to mark my tube. So I have it marked at 53 centimeters. place my 60 ml syringe on the end of my tube. I'm going to hand my partner a cup of water, and also for this procedure, my lubricant. I'm going to put this in 2 to 4 inches. And then I'm going to let my client know we're going to go in your nose now. This may be uncomfortable. Just some nice slow deep breaths. When I tell you we're going to put your chin to your chest, we're going to have you take some sips of water. All right, so I'm going to start by getting in the nair to start with. I'm going in the right nair. As I pass the oropharynx or the nasopharynx, I'm going to go ahead and tilt their chin to their chest, have them take some sips of water.
Swallow, swallow. Oh, you're doing well. Swallow, swallow. Keep on, you're doing well.
As they're swallowing, that's when I'm inserting my tube. If at any point they start coughing, gagging, I'm going to use a tongue depressor and look in the back of their mouth with my pen light and see if it's curled up in the tube, curled up in the back of their throat. If it is, I'd withdraw it a little bit and then try and straighten it out and put it back in. If I'm having some trouble getting through, I can try rotating it and then inserting all the time while they're swallowing. If at any point they have any signs of distress, they can't speak, they become cyanotic, their oxygen level decreases, then I would stop the procedure and then let the provider know we were unable to complete the procedure. Once I'm at my mark, I'm going to get a temporary tape job, and it doesn't have to be pretty, it just has to be enough to hold it in place as we confirm placement. I'm gonna get my suction ready to go in a minute, but not yet. I'm gonna take about 5 mils of fluid, put it on my pH strip. I'll give it about 30 seconds, and then I'm going to see if my pH is less than 5. If it's less than 5, I'm in good placement. Then if my facility dictates that I get a chest x-ray, I'm gonna get a chest x-ray to confirm placement. Once we have placement confirmed, I'm gonna do a more permanent tape job. I'm gonna get this temporary off. My partner's holding the tube for me so that doesn't move. Then I'm going to remove my syringe and connect this to suction per the provider order. So can you turn my suction on for me? Perfect. It's to intermittent suction. Rechecking my pulse ox to make sure that my patient tolerated this well. I would then remove my gloves and have my client turn their head the opposite way the opposite side. To the opposite side, I'm going to do a half hitch. Safety pin this to my client's gown and then go in the middle. I would then grab a pair of clean gloves and provide any oral care for my client. So clean, clean, clean. Then I would get rid of all of my supplies that I used for this. So I'm going to grab my pulse ox, my Chuck's pad, my tissues, my piston syringe, and get that ready to go out of the room. I'm gonna raise the rail, lower the bed, educate my client that if they need to get out of bed to please call me because they have that tube in, that it's emptying their stomach right now, they're only to have sips of water, whatever the provider ordered, or nothing. It just kind of depends. But definitely to call me because we don't want that tube to come back out. I would make sure they have their call light, assess their comfort level again, remove my gloves, perform hand hygiene, and then I would document that I inserted a 12 French NG tube into their right nair. I connected it to low intermittent suction per the provider order and any content that I had come out. And I would also need a piston syringe for this procedure. Knock on the door, perform hand hygiene, introduce myself to the client, identify them, and then let them know that we're going to remove the NG tube out per their provider order. I'm going to place a Chuck's pad over their chest, emesis basin and tissues, and if she wasn't already in a high Fowler's position, I would put her in a high Fowler's position, raise the bed, lower the rail, don clean gloves, disconnect them from suction and discontinue the suction. I would grab a 60 ml syringe, putting 30 ml of air in, and flush it just to clear out the tube. I would grab my safety pin and rubber band and take that off the client's gown. I would very carefully remove any tape from their nose. If I needed an alcohol pad to kind of loosen it up, I would. And then I would tell my client, take a nice big deep breath when I tell you, and then we're gonna get this tube out. I'm crimping my tube. Nice big deep breath in. Hold it, 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 and then I'm gently taking it out. Wrapping this in my Chuck's pad, you can breathe. And then disposing of it per my facility policy. I would then allow my client to instruct my client to blow their nose, perform oral care for my client, remove all of the belongings there, raise the rail, lower the bed. I would measure the amount of NG drainage out of my canister. I dispose of it per my facility policy, remove my gloves, perform hand hygiene, and then document the amount of drainage that I got out of the NG tube, that I removed an NG tube, the client tolerated, denied pain before, during, and after the procedure. The patient was educated about what diet they're allowed to have, what to expect, and to notify me if they had any nausea. The end.